One of the earliest silent signs of heart trouble is fatigue that doesn't make sense. Not the kind that comes after a bad night's sleep, but persistent, unexplained tiredness. When the heart has to work harder to pump blood through stiff or narrowed arteries, less oxygen reaches your muscles and tissues. The result? Everyday activities start to feel like effort. Climbing stairs feels steeper. Carrying groceries feels heavier. Many people chalk this up to aging, stress, or being out of shape. But sometimes it's the cardiovascular system quietly struggling behind the scenes. Another subtle red flag is shortness of breath during routine tasks. If walking across a parking lot or doing light housework suddenly leaves you winded, that may be your heart signaling reduced efficiency. When arteries are narrowed, the heart must pump harder to deliver oxygen-rich blood, especially during movement. You might not feel chest pain at all, just breathlessness. This is particularly common in women, where classic textbook symptoms don't always show up. Swelling in the feet, ankles, or lower legs can also point toward heart strain. When the heart's pumping ability weakens, blood can back up in the veins, causing fluid to leak into surrounding tissues. Shoes feel tighter. Socks leave deeper marks. Many assume it's just standing too long or salt intake. But persistent swelling deserves attention. It's not always dramatic, just a gradual puffiness that creeps in. Frequent dizziness or lightheadedness can be another quiet signal. If the heart isn't pumping effectively, blood flow to the brain can momentarily drop, leading to feelings of faintness. Sometimes this shows up as brief episodes when standing up quickly, but repeated or unexplained dizziness may be a cardiovascular clue rather than just dehydration or low blood sugar. Let's talk about the jaw, neck, and shoulder area. Discomfort here, especially during exertion, can be referred pain from the heart. Not sharp, stabbing pain, but pressure, tightness, or aching that comes and goes. Because it doesn't feel like chest pain, many people ignore it or blame posture or muscle tension. Yet the nerves that supply the heart overlap with those regions, so the brain can misinterpret where the signal is coming from. Digestive discomfort can be another surprising heart-related symptom. Nausea, indigestion, or a heavy, burning sensation in the upper abdomen, especially if triggered by physical activity, may actually be cardiac in origin. The heart and stomach share nerve pathways, which is why heart-related pain sometimes masquerades as heartburn. If symptoms appear during exertion and ease with rest, that's a clue worth taking seriously. Changes in sleep can also be tied to heart health. Waking up short of breath, needing extra pillows to breathe comfortably, or feeling your heart racing at night can reflect fluid shifts and strain on the heart. Poor sleep and heart disease have a two-way relationship. Sleep problems can worsen heart health, and heart dysfunction can disrupt sleep. One of the most overlooked silent signs shows up not in how you feel, but in how you perform. A decline in exercise tolerance, getting tired sooner, needing longer recovery, or avoiding activities you used to handle easily can be an early warning. Many people unconsciously reduce activity to avoid discomfort. So the problem hides behind lifestyle changes. I just don't feel like walking as much may actually be the body's way of coping with reduced blood flow. Erectile dysfunction can also be an early cardiovascular signal in men. The arteries in the penis are smaller than coronary arteries, so they can become narrowed by atherosclerosis sooner. Difficulties with blood flow there may precede heart symptoms by years. Rather than viewing it as an isolated issue, it can be a window into overall vascular health. Cold hands and feet, or slow-healing wounds may indicate poor circulation. When arteries narrow, the body prioritizes blood flow to vital organs, sometimes at the expense of extremities. It's subtle, hands that always feel chilly, cuts that take longer to close, but it can reflect systemic vascular issues. Now here's the empowering part. Many of these silent signs stem from the same root cause: impaired blood flow due to atherosclerosis, the buildup of fatty plaques in artery walls. And unlike aging, this process isn't inevitable. Lifestyle choices can influence whether plaques grow, stabilize, or even shrink. Research consistently shows that diets centered on whole plant foods, fruits, vegetables, whole grains, beans, nuts, and seeds are associated with healthier arteries and lower rates of heart disease. These foods are naturally low in saturated fat and cholesterol, rich in fiber, antioxidants, and anti-inflammatory compounds that support endothelial function, the delicate lining of our blood vessels. When the endothelium works well, arteries can relax and expand, improving circulation. On the flip side, diets high in saturated fat, trans fats, and highly processed foods can impair that same endothelial function within hours of a meal. Over time, repeated injury to the artery lining contributes to plaque formation. The process is slow, silent, and cumulative, which is why symptoms may take years to appear. Physical activity is another powerful signal to the heart and blood vessels. Regular movement improves circulation, strengthens the heart muscle, and enhances the ability of arteries to dilate. Even moderate activities like brisk walking can make a measurable difference. The key is consistency, not intensity. Sleep, stress management, and avoiding tobacco also play major roles. Chronic stress hormones can affect blood pressure and inflammation. Smoking directly damages blood vessels and accelerates plaque buildup. The heart responds not just to what we eat, but how we live overall. The take-home message is that heart disease rarely begins with a dramatic event. It often starts with quiet whispers, a little more fatigue, a bit more breathlessness, subtle swelling, odd discomfort in unexpected places. Listening to those signals doesn't mean panic, it means paying attention. If you notice persistent or worsening symptoms, especially in combination, it's important to seek medical evaluation. Simple, non-invasive tests can assess blood pressure, cholesterol, blood sugar, and other markers that reflect cardiovascular risk. The earlier issues are identified, the more reversible they tend to be. Your heart works nonstop, every second of your life. When it starts sending soft warning signs, it's not betraying you, it's communicating. And with informed choices, supportive habits, and timely care, those whispers can become a turning point rather than a crisis. Feeling drained all the time isn't always about getting older, sleeping poorly, or being too busy. Persistent, unexplained fatigue can be one of the earliest and most overlooked signs that the heart may be under strain. When the cardiovascular system isn't working efficiently, every cell in the body can feel the consequences. Your heart's job is to deliver oxygen, rich blood to tissues and organs. When arteries become narrowed or stiff, the heart has to work harder to push blood through. Even if this change is mild, it can mean that muscles and organs receive slightly less oxygen than they need, especially during activity. The result may not be dramatic chest pain, but something much quieter, a steady drop in energy. Simple tasks start to feel surprisingly difficult. Climbing a few stairs leaves you more winded than before. Carrying groceries feels heavier. You may find yourself needing to sit down more often or avoiding activities you once handled easily. Because this shift usually happens gradually, many people adjust their routines without realizing it. "I'm just getting older" becomes the explanation, while the real issue, reduced circulation, continues to develop silently. Fatigue related to heart strain often doesn't improve much with rest alone. It's more like a background exhaustion that lingers day after day. Some people also notice reduced mental sharpness or motivation, since the brain, like muscles, depends on steady blood flow. Of course, fatigue has many possible causes, from anemia to thyroid issues to chronic stress. But when low energy is persistent, unexplained, and accompanied by other subtle changes like breathlessness or decreased stamina, it may be the heart quietly asking for attention. Getting out of breath from activities that used to feel easy can be more than just being out of shape. When shortness of breath shows up during normal, everyday movement, like walking across a room, climbing a few stairs, or doing light housework, it may be a subtle sign that the heart is having trouble keeping up with the body's demands. Your heart and lungs work as a team to deliver oxygen to your tissues. When the heart's pumping ability is reduced or blood vessels are narrowed, oxygen-rich blood doesn't circulate as efficiently. During physical activity, muscles need more oxygen, and if supply can't meet demand, the body responds with the sensation of breathlessness. You breathe faster and deeper, trying to compensate for what the circulation system can't fully provide. What makes this symptom easy to miss is how gradually it can develop. You might not suddenly feel unable to breathe. Instead, you just notice that you have to pause more often, take the elevator instead of the stairs, or slow your pace to avoid feeling winded. Many people blame aging, weight gain, or lack of fitness, not realizing that the root cause may be cardiovascular. In some cases, Fluid can also build up when the heart isn't pumping effectively. This fluid may back up into the lungs, making it harder for oxygen to move into the bloodstream. The result can be a feeling of tightness in the chest, or the need to prop yourself up with pillows at night to breathe comfortably. Occasional breathlessness after intense exertion is normal, but if mild activity regularly leaves you short of breath, especially if it's new or worsening, it's a signal worth taking seriously. Noticing that your shoes feel tighter by the end of the day or that your socks leave deep marks on your ankles might not seem like a heart issue at first. Many people blame heat, standing too long, or eating salty foods. But when swelling in the feet, ankles, or lower legs becomes persistent, it can be a quiet signal that the heart isn't pumping as effectively as it should. Your circulatory system works under pressure. Blood travels from the heart through arteries and returns through veins. When the heart's pumping strength weakens, blood can move more slowly on its return trip. This causes pressure to build in the veins, especially in the lower body where gravity already makes circulation more challenging. That increased pressure pushes fluid out of the blood vessels and into surrounding tissues, leading to visible swelling, also called edema. This kind of swelling often develops gradually. At first, it may come and go, appearing after long days on your feet and improving overnight. Over time, it can become more constant. You might notice your ankles looking puffy, your skin appearing stretched or shiny, or an indentation remaining for a few seconds after you press on the area with a finger. Fluid buildup related to heart function doesn't just stay in the legs. It can also affect the abdomen or even the lungs in more advanced cases. That's why leg swelling sometimes appears alongside other subtle symptoms like shortness of breath or unusual fatigue. While swelling can have many causes, including kidney, liver, or vein problems, ongoing unexplained puffiness in the lower legs deserves medical attention. It may be one of the body's early visual clues that the heart needs support. When most people think of heart trouble, they picture dramatic chest pain. But the body doesn't always follow the textbook. The heart shares nerve pathways with other areas of the upper body, which means cardiac discomfort can be referred to places far from the chest. That's why pressure, tightness, or aching in the jaw, neck, shoulders, upper back, or even the upper stomach can sometimes be linked to the heart, especially if it shows up during physical or emotional stress. This type of discomfort is often described as dull, heavy, squeezing, or aching rather than sharp or stabbing. It may come on with exertion, like walking uphill, carrying something heavy, or hurrying, and then ease with rest. Because the sensation isn't centered in the chest, many people assume it's a muscle strain, dental issue, arthritis, or simple indigestion. As a result, the warning sign gets brushed aside. The reason this happens comes down to how nerves carry pain signals. The brain isn't always great at pinpointing the exact source of internal discomfort. When the heart muscle doesn't get enough oxygen, rich blood, a condition called ischemia, the nerves transmit distress signals that the brain can interpret as coming from nearby regions. Upper abdominal discomfort can be especially confusing. Some people experience a heavy, burning, or tight feeling that feels like heartburn or an upset stomach. If this sensation appears during activity and improves with rest, it raises the possibility that the heart, not the digestive system, is the source. Paying attention to patterns matters. Repeated discomfort in these areas triggered by exertion or stress should never be ignored, even without classic chest pain. A gradual drop in your ability to do everyday activities can be one of the quietest signs that something is changing in your cardiovascular system. Because it happens slowly, it's easy to miss. You don't wake up one day suddenly unable to function. Instead, you just notice that things feel a little harder than they used to. Maybe you used to walk a certain route without thinking, but now you cut it short. Maybe household chores leave you needing breaks. Perhaps you recover more slowly after physical effort or feel unusually worn out the next day. These small shifts often get blamed on aging, stress, or being out of shape, but they can also reflect the body adapting to reduced blood flow. When circulation isn't optimal, muscles don't receive oxygen as efficiently during activity. The heart may be working harder behind the scenes, even if you don't feel obvious chest pain. To protect itself, the body naturally encourages you to slow down. You might unconsciously pace yourself differently, avoid stairs, or choose more sedentary options. Over time, this reduced activity can further decrease fitness, making the decline feel normal rather than concerning. This change in exercise tolerance is important because it often shows up before more dramatic symptoms. It's like your body quietly lowering the volume on what it can comfortably handle. Instead of a sharp alarm, it's a subtle dimming of stamina. Of course, many factors can influence endurance, including sleep, nutrition, and stress levels. But if you notice a consistent, unexplained decline in what you can do physically, especially alongside fatigue or breathlessness, it may be a signal that your heart and circulation deserve a closer look.